Is diabetes patient more prone for diabetic foot ulcers or infection? Hello everyone, this is Dr. Jayaditya Ghosh, consultant endocrinologist, Yashoda Hospital, Malakpet. So as I was saying, patients with diabetes do have increased risk of diabetic foot ulcers and infections. So why do they develop this increased risk of diabetic foot ulcers and infections? So in patients of diabetes, there is development of diabetic neuropathy in long-term uncontrolled diabetes mellitus. So when the patient develops diabetic neuropathy, there is loss of sensation, or in sometimes the patient may also be feeling burning or tingling sensation in the feet. So these symptoms of burning sensation, tingling sensation, or sometimes numbness in the bilateral lower limbs are symptoms that the patient is actually developing diabetic neuropathy. So once the patient develops diabetic neuropathy, they are more prone for development of diabetic foot ulcers and infection. So they should be more cautious and they should be actually taking more care of their feet. As we daily take care of our face in the mirror, we should also similarly take care of our feet in the same manner. So what should we do and what should the things to be done to prevent this diabetic foot ulcers and infections? So we should carefully wash the feet with soap and water daily. We should apply moisturizer or creams to the feet to prevent crevices or cracks in the feet. What happens if cracks develop? So when cracks develop in our skin area, so these are actually crevices through which infection can enter the feet, and later this can be leading to diabetic foot ulcers and infection. Similarly, we should always wear slippers. We should not walk barefooted even at home, because in patients who are having numbness, those patients may not feel if they have minor trauma to the feet while walking barefooted. So in those conditions can lead to the development of ulcer and infection. So once the ulcer and infection develops in a diabetic foot patients, in those patients the healing of the process is delayed and it can be hampered in those scenarios. So washing the feet is very important, applying creams or moisturizer to prevent development of crevices and cracks and to prevent the dry skin which is present in diabetic patients, and washing and wearing slippers daily, like not walking barefoot outside or even inside the house is very important. So washing the feet with soap and water and applying cream is very essential to prevent the dry skin that may develop in diabetic foot patients, as well as wearing slippers everywhere, like outside as well as inside, to prevent unnoticed trauma in the feet is also very essential to prevent the development of diabetic foot ulcers. The footwear is also very essential. Better to wear a sandal in diabetic foot patients without a foothold in the toes, because sandals help you to have a proper grip that may not be there in diabetic foot patients. They also may have slippage of chappal sometimes, so better to use a sandal with a thick sole and a soft cushion effect that will help prevent development of ulcers in these patients. So if you follow these instructions and carefully examine the feet daily, at that time we can prevent the development of diabetic foot ulcers and infections in patients of diabetes. Thank you.
Like, comment, and subscribe for more health updates.